Hey guys, we're going to talk about a few myths today in pregnancy and answer some of your questions that I've been asked many times in the office from my own pregnant patients. This is going to be a mixture of some myth busting and answering just some common questions about things having to do with pregnancy. So here we go. Can I eat sushi? The answer is maybe a little. Research is a bit conflicting on this. The main concern, of course, is mercury contamination of the types of fish that would be used in sushi. I tell people I wouldn't eat it every day, I wouldn't eat it every week, but if you had a special occasion, you went out one time in your whole pregnancy and had some sushi, I really don't think it's that big of a deal. There is research that has come out in the last year that would also indicate that that's probably the right answer. We know that in general, fish consumption is a good thing, but excessive amounts could still be a concern. The FDA's guideline is no more than 12 ounces of fish per week or no more than 2 fish meals per week. The only other concern about sushi is just the fact that you're eating uncooked or undercooked fish. Of course, there is a risk there for anybody, and I'll tell patients the same thing. If you're eating from a really high quality sushi restaurant that you've been to many times before and never had a problem, it's pretty unlikely you're going to have a problem while you're pregnant. But of course, there's still that small risk. Can I drink my coffee? 1 or 2 cups a day is fine. Over about 300 milligrams a day, there could be some issues. In the first trimester, there's even a potential link with miscarriage, so I try to minimize the use in the first trimester, but after that, 1 or 2 cups a day is not that big of a deal. What about artificial sweeteners like aspartame? Well, it turns out that's one of the most studied food products in the world. There really is no risk unless you have what's called phenylketonuria, PKU, and if you have it, you know it because you can't eat it at all. It causes major metabolic problems. So as long as you or your partner don't have that, it's really no concern. Saccharin still may be a little bit of a question, so I'd avoid saccharin, although you don't see it very much anymore. Can I work out while I'm pregnant? Yes. Not only can you, you should. You should stick to mostly cardio type exercises and light weightlifting to maintain tone, but not really heavy lifting. I tell people to avoid like the big squats and bench presses, and also definitely avoid exercising flat on your back, especially later in pregnancy, because this can cause a pretty significant drop in blood pressure, and that's not good for you or baby. And there definitely are circumstances where you shouldn't be exercising at all, such as if you have preeclampsia or if you're having problems with preterm labor, things like that. So always check with your doctor if you have a question. But in general, exercise is a good thing. Can I ride roller coasters? Don't recommend it. Don't recommend anything that's sort of bumping or jarring, major big turns, pulling high G's. These kind of things could interrupt the interface between the placenta and the uterus. That's definitely something to avoid. And let's be honest, it's just not that important that you go to Lagoon while you're pregnant. Is it okay to have sex while I'm pregnant? Yes, it's fine. There's a few situations where you should avoid preterm labor, bleeding in pregnancy, placenta previa, ruptured membranes, things like that. Very high risk pregnancies. Yes, we're going to tell people to avoid intercourse, but in your normal, healthy, everything's fine, low risk pregnancy, intercourse is fine. I do tell people you might have a little bleeding after sex sometimes, but if you have none of those other high risk issues, this is nothing that you need to worry about. It's perfectly normal. How about hair coloring? It's totally fine. Hair coloring is just affecting part of the tissue that's outside your body and is dead, and nothing is absorbed into your bloodstream, so coloring your hair is not a risk at all. Color away. What about changing the litter box? That's not your job when you're pregnant. There is a concern there with a parasitic infection called toxoplasmosis. You're mostly going to find that in cats who have had some time outdoors at some time in their life. However, you just never know. It's not worth the risk. It comes from ingesting material from the feces. It can't even be aerosolized in the air. When you scoop, you see that stuff kind of bubbling up there. You can breathe that in and that can cause a problem. So litter box, not your job when you're pregnant. It's okay to pet your cat though. Just don't eat the poop. People ask me all the time if it's okay to fly when you're pregnant, and the bottom line is yes, but I wouldn't fly in the last month or so of pregnancy, so after 36 weeks, and even 34 to 36 is a little bit of a risk. You never know, you could go into labor, your water could break, And if you're halfway across the country and you have to divert the plane to Chicago, it's going to make it really hard for people to come see you and the baby when you deliver in some place that you don't live. I have a dental appointment coming up. Is that okay? Yes, good dental hygiene is really important, not only for your health, but for the pregnancy's health as well. So, definitely recommend routine dental care. If the doctor recommends that you have a cavity filled or something like that, get it done. People ask all the time if it's okay to have local anesthesia when they're having their dental work. It's totally fine. Been asked a lot also about x-rays, if they have to x-ray something in your mouth. If it's absolutely necessary, then I'd tell people to go ahead, but of course make sure your abdomen is shielded with a lead shield. I even recommend just double shield to play it safe. 1 or 2 x-rays like that, it's not going to hurt a thing. Sleep positions in pregnancy. Get that question every day. Definitely don't want to sleep flat on your back, especially in the last half of pregnancy. The concern is, as the uterus is getting bigger, it can compress the blood vessels that flow from the lower extremities back up to the heart. That reduces blood pressure, therefore reducing perfusion to the placenta. That can be an issue. We sometimes see that on ultrasound when we're looking at the baby in the office, and you'll see the baby's heart rate drop, the mom's laying flat on their back. We get them to turn to one hip or the other, heart rate comes right back up. So same concept when you're asleep. We don't want you, for prolonged periods of time, on your back. So if you're a back sleeper, get a pillow wedged underneath one side or the other, just so you have a little bit of a tilt, and then you should be fine. Now for some myths. Baby's hair does not cause heartburn, period. Don't raise your arms above your head. It's going to do something to the baby and strangle them. It's crazy. Heart rate indicates gender. Totally wrong. They start out fast. They kind of generally slow as you go through the pregnancy. Position of the gestational sac in the uterus. Left side's a boy, right side's a girl, whatever. Completely untrue. Maybe the best myth of all time. I had a patient last time there was a solar eclipse that came to the office and told me that her mom specifically told her that she had to wear red underwear during the eclipse or the baby would have birth defects. I got nothing. Hope you enjoyed this discussion of a lot of common questions, busted a few myths. If you have other questions, put them in the comments below. I'll be happy to answer them. Thanks for watching.